So alcohol is one of the most difficult things to study always, because first of all, everybody lies about alcohol. And second of all, which may not be clear to everybody, alcohol seems to be more individual than people may have thought. It's not like when 5 people drink 1 glass of something a day, that they will end up with the same findings. The question we had was really whether, I mean, we know that alpha-1 antitrypsin patients are liver-wise a very fragile population. And we were trying to ask the question which we hear a lot in our everyday patient counseling, and that is, am I allowed to, drink at a birthday 1 glass of wine? Do I have to stop my social life, or can I be a little bit normal? So that was really the question. And our feeling is, fortunately, that this, what you say, normal social level consumption seems to be tolerated fairly well in a majority of alpha-1 antitrypsin patients, even patients with a severe alpha-1 antitrypsin deficiency, which is obviously a sign of relief for many people. At the same time, I think we cannot exclude the opposite. That means that there might be some patients who may react very kind of sensitive to alcohol. So I think for patients with alpha-1 antitrypsin deficiency, you need to basically get a checkup where you stand. And if everything looks good, you can continue your life as it was. So we typically do the liver stiffness measurement by fibroscan, and you do the normal liver enzymes checkup. And this is what we actually did in the counseling before. We were saying, if all the signs look good, drink as much as you did because it seems to work, and vice versa. If not everything looks good and there might be some alcohol consumption, try to reduce it and see whether it helps. So in that sense, it did not change much in the everyday counseling, because I think it's always in life, like, you have to look at the cards which you have in your hand, and then you can decide how you play the game. So that's, if you have great cards, it's easy to play. If you don't have great cards, you have to be much more cautious, and you have to play a much more defensive play. And that's I think what the study showed. It also showed that some of the patients may not tell us exactly the same thing as the objective biomarkers are telling. Again, there may be more reasons for that. Sometimes it may be even difficult to say, because, I mean, if I would ask you now how much alcohol you drank in the last month, you probably would not know. You would not say a completely wrong answer, but there is a certain chance that you would actually say 2 or 3 times more or 2 or 3 times less, because you just don't make a calendar, and these things are really not that easily quantifiable. So I think it showed that an alpha-1 patient does not have to panic and completely stop the social low-level alcohol consumption, especially when all the liver-related parameters look good. Vice versa for the clinicians, if things don't look that well, I think you need to always combine an objective measurement of alcohol consumption with the anamnestic data, because not everybody tells you information that you can 100% trust.